Chairwoman Jones and members of the committee. I want to thank you for allowing me to introduce myself to you today. Governor Kasich offered me this exciting opportunity to use my management and healthcare experience to lead the Ohio Department of Health from a good organization to a great one. As you know, Governor Kasich has not been shy about pursuing change, including in healthcare, when it will help government work more effectively for Ohioans. As a result, ODH now functions under a new leadership model to better respond to an evolving public health system. I'm an experienced chief executive officer with a highly trained medical team. This new structure allows me to lead the operational complexities of the state agency and direct health and strategic priorities while freeing medical staff to focus their attention on clinical issues. And I'm honored to acknowledge the presence of our interim outgoing medical director, Dr. Mary Applegate, and our permanent medical director, Dr. Mary DiOrio, who have joined me today. Our new leadership structure was tested during the state's recent response to the Dallas healthcare worker who visited Ohio and then tested positive for the Ebola virus. After we were alerted by CDC, I quickly mobilized the ODH team, and we immediately pulled together state government partners, external health partners, and the Centers for Disease Control to collaborate on this issue. I focused on directing the operational aspects of the ODH's Ebola response, and we relied on the medical team to drive the clinical process, including providing guidance to local health departments, hospitals, and other healthcare providers. We can all be proud of Ohio's aggressive Ebola response, but we must remain vigilant since Ebola remains a potential public health issue for which we must continue to be prepared, and we will remain vigilant and prepared. As you may have read in my submitted biography, I am not a medical doctor. I have held management and senior leadership positions in both the public and private sectors for more than 27 years, and was responsible for addressing healthcare issues in many of those positions. I have a track record as a CEO for helping good organizations become even more successful. I have a vision for the future of ODH, particularly in this changing environment. I'm joining the Ohio Department of Health at a time when both the public health and clinical care fields are being transformed by President Obama's Affordable Care Act, by the extension of Medicaid benefits, by Ohio's efforts to transform health care and rebalance Medicaid, and by state and federal budget constraints. The Ohio Department of Health has begun the process of transitioning the department from a programmatic-focused agency to one that is leading statewide policies to improve Ohio's overall system of public health. The recent measles and mumps outbreaks, the Toledo water crisis, and the evolving Ebola situation reflect the agency's need to enhance its organizational capacity in emergency preparedness. Our policy initiatives should be data-driven and focus on core public health priorities: health improvement and wellness across the lifespan, environmental health, and infectious disease. Embedded in these public health priorities are efforts to reduce infant mortality, curb tobacco use, and address health equity issues and social determinants of health. Elevating ODH's operational effectiveness will be a key focus under my leadership, and I'm building our in-house medical team to do what it does best: provide clinical expertise and guidance to inform our policy development and regulatory processes as we return to our core public health mission. I'm leading ODH to fulfill its mission. I look forward to engaging our talented public health workforce and engaging you as we develop policies to protect and improve the health of all Ohioans. I'm happy to answer any questions you may have at this time.